Hi, I'm Dr. Katherine Harris. Thank you for being here with an open mind and a sincere curiosity about your own well-being. Today, we're going to talk about something both ordinary and surprisingly misunderstood: the benefits of male masturbation. We'll treat this like any other aspect of health, calmly, respectfully, and based on what we know from physiology and psychology. If you're a parent or a caregiver, this conversation can help you speak about sexual health more responsibly with the young adults in your life. If you're a man, it can help you relate to your own body with more kindness, clarity, and confidence. And if you're a partner, it can help you understand how self-stimulation can fit into a healthy relationship without shame or secrecy. Before we begin, a very important note: this video is for adults. We won't share explicit details or demonstrations, and nothing you hear today replaces individualized medical advice. If you have pain, persistent sexual dysfunction, or concerns about your hormones, prostate, or pelvic health, please consult a qualified healthcare professional. My goal is to offer you a comprehensive, stigma-free overview so you can make informed, healthy choices for your life. Let's start with something simple and powerful. Your body is not an enemy to be subdued. Your body is an ally that speaks to you in many dialects: hunger, fatigue, pleasure, discomfort, anticipation, and relief. Masturbation is one of the ways your body participates in regulation. It can help modulate stress, discharge tension, and create a clearer mind. And because it's private, fully consensual with yourself, and adjustable to your own boundaries, it is also one of the safest forms of sexual expression available to adults. When people ask me, "Is masturbation healthy?" I invite them to first notice the tone of the question. Often it carries the weight of myths. Someone might fear it will reduce testosterone, cause hair loss, drain motivation, or somehow rewire the brain in a harmful way. Someone else might worry it's morally questionable or incompatible with a relationship. These are understandable concerns in a culture that can be both hypersexualized and deeply shaming at the same time. The antidote is not defensiveness, it's education. So let's explore the benefits thoughtfully, including the physiological, psychological, and relational dimensions, as well as sensible guardrails and habits that keep the practice healthy. One of the most immediate benefits of masturbation is stress regulation. The human nervous system is constantly responding to the world: alerts, obligations, deadlines, uncertainty. Sexual arousal and orgasm involve neurochemistry that can temporarily reduce the intensity of stress signals. After climax, many people experience what we call a parasympathetic rebound. The body shifts from go mode toward rest and digest. This is often experienced as a soft, calm afterglow: slowed breathing, loosened muscles, and a quieter mind. For some, this helps with sleep onset, particularly on nights when mental chatter makes it hard to drift off. You can think of it as one tool in your toolkit, alongside breathwork, gentle stretching, reading, or listening to calming audio. It doesn't replace those practices. It complements them. Masturbation also supports body literacy, your personal understanding of how arousal, plateau, orgasm, and resolution unfold for you. Many men were never taught that sexual response is a process with phases, not a single on-off switch. Self-stimulation allows you to observe your own arousal curve, learn how quickly you escalate, what helps you maintain a comfortable plateau, and what tends to tip you over the edge. This knowledge is not trivial. It's central to sexual confidence. In partnered intimacy, the men who feel most grounded often know how to slow down, breathe, and ride their own wave rather than fighting it. They understand cues, tingling, pelvic floor contractions, changes in lubrication if a product is used, subtle shifts in sensitivity, and they use that awareness to be present, not performance-driven. That presence is attractive, and it's kind. There's another benefit that is both practical and deeply human. Masturbation can be a compassionate alternative when circumstances make partnered sex complicated or unavailable. Travel, long-distance relationships, parenting schedules, recovering from illness, or simply not being in the mood at the same time as a partner. In those moments, self-stimulation can prevent the buildup of pressure or resentment. It can also reduce the temptation to make choices misaligned with your values, like seeking risky encounters. In this sense, masturbation is a tool of sexual ethics, not their violation. It protects fidelity by giving you a safe outlet under your control. Now let's talk about sexual function. Many men are concerned about premature ejaculation. They feel trapped in an onrushing wave, unable to pause or stabilize. One evidence-informed strategy is the stop-start or pause-breathe-continue approach. In a private, non-judgmental context, a man can practice gradually building arousal, noticing the point of no return, then pausing stimulation while focusing on slow exhalations and relaxing the pelvic floor. This is not about shaming your body into submission. It's about cultivating sensitivity to the signals that precede ejaculation and learning to modulate them. Over time, this practice can translate into partnered contexts, improving both satisfaction and communication. While I won't provide explicit technique instructions here, the principle is straightforward. Learn your cues, practice pacing, and focus on breath and pelvic relaxation. Masturbation provides a laboratory for that learning. Related to this, masturbation can help some men who experience delayed ejaculation by allowing them to explore different rhythms, thoughts, and sensory inputs without the pressure to perform. Sometimes delayed ejaculation has psychological roots: anxiety, fear of losing control, or hyperfocus on doing it right. Sometimes it has medical contributors, medication side effects, neuropathy, or hormonal issues. Either way, self-exploration can be diagnostic. It helps you notice what's possible alone versus with a partner, which can guide a conversation with your clinician. Remember, if you have persistent difficulties reaching orgasm or maintaining an erection, please seek professional evaluation. Sexual symptoms are sometimes the earliest indicators of cardiovascular or endocrine issues, and early care matters. Let's address the question of hormones, because it comes up constantly. Does masturbation lower testosterone? In healthy adults, occasional ejaculation does not chronically suppress testosterone levels. Hormone regulation is nuanced, influenced by sleep, nutrition, resistance training, body fat, circadian rhythms, and overall metabolic health. If you notice fatigue, low mood, reduced libido, or decreased morning erections over a sustained period, that's a signal to speak with a clinician. But the act of masturbation itself, in a typical pattern, isn't the culprit behind a systemic hormonal collapse. What sometimes does erode vitality is the triad of insufficient sleep, chronic stress, and sedentary lifestyle. Those are bigger levers to address, and they're addressable. Another area where masturbation may play a role is prostate comfort. Some men report a sense of fullness or aching in the pelvic region when they've gone a long time without ejaculation. While research is still evolving, orgasm can help evacuate prostatic fluid and relieve congestion for some individuals. This is not a cure-all, and it does not replace medical assessment if you have urinary symptoms, pain, or inflammation. But for men without pathology, regular ejaculation, whether with a partner or via masturbation, can subjectively relieve pelvic tension. If you experience persistent discomfort, difficulty urinating, fever, or blood in semen, please seek care promptly. Masturbation should never be used to ignore red flags. Let's bring in mental health more explicitly. We live in an age of constant stimulation, notifications, scrolling, background anxiety. Masturbation can offer a moment of embodied presence. When done mindfully, it becomes less about chasing an abrupt dopamine spike and more about grounding yourself in sensation, breath, and tenderness. The difference is attention. If you approach self-stimulation as a quick fix for boredom, you train your brain to pair arousal with distraction. If you approach it as self-care, quiet space, slow breathing, consent with yourself, no pressure to perform, you cultivate healthier patterns. This mindful orientation decreases the likelihood of compulsive behavior because you're practicing regulation, not escape. And that brings us to a necessary boundary: frequency. People ask me for a number. How many times per week is healthy? There isn't a universal quota. The line between helpful and harmful is functional. Does your habit interfere with your daily responsibilities, relationships, sleep, and energy? Do you feel compelled to masturbate in situations that put your privacy, work, or safety at risk? Do you notice escalating novelty seeking, needing more intense stimuli to feel anything at all? These are signals to pause, reflect, and possibly recalibrate. A healthy pattern is one that aligns with your values, respects your time, preserves your focus, and nourishes your well-being. If you need help right-sizing the habit, consider simple guardrails, preset time windows, avoid pairing with endless scrolling, and commit to mindful pacing instead of a frantic rush. Let's talk briefly about pornography. I won't moralize. Adults make choices according to their values and communities. But for brain health, it's important to separate masturbation from relentless novelty. The human reward system is sensitive to pattern. If you pair arousal exclusively with rapidly changing, high-intensity visual stimuli, you can blunt responsiveness to ordinary, real-life intimacy. Many men find that when they reduce or take breaks from porn and re-anchor self-stimulation in their imagination or in slower, less extreme cues, their sensitivity and satisfaction improve. This isn't about shame, it's about reclaiming your attention so your body can respond to presence, affection, and subtlety again. If you notice erectile difficulty specifically with a partner, but not alone with certain media, that contrast can be instructive. Again, if problems persist, a professional evaluation is wise. Hygiene and safety are straightforward but important. Wash your hands before and after. If you use lubricant, choose a product that's skin-friendly and unscented if you're prone to irritation. If you use any device designed for sexual stimulation, make sure it's body-safe, intact, clean, and used according to instructions. Never share personal devices. If you notice chafing, small tears, or discomfort, give yourself time to heal. Pain is a signal, not a test of toughness. And if you ever experience sudden severe pain, swelling, or any injury, seek care immediately, especially if an erection doesn't resolve when it should. There's no shame in protecting your health. Now let's look at relational benefits. One of the quietest gifts of masturbation is that it can improve communication with a partner. Men who know their arousal curve can participate in co-regulation, slowing down, checking in, and voicing preferences without drama. They're less likely to view sex as a pass-fail performance and more likely to frame it as a shared experience. Self-knowledge also reduces the fear that you have to get everything right on the first try. You can say, "Give me a moment, I'll slow my breathing," or "I'd like to change the pace." You can reassure a partner that if either of you aren't in the mood, that's okay. Intimacy has many expressions. The paradox is that when the pressure to perform decreases, desire often becomes more spontaneous. Masturbation can also help men cultivate self-compassion around fluctuations in libido. Desire is not a fixed resource. It changes with sleep, nutrition, stress, grief, joy, medication, illness, and seasons of life. Some periods are more charged, others quieter. When masturbation is allowed to be a gentle, non-dramatic outlet, it prevents you from attaching existential meaning to every rise or fall in libido. You stop measuring your worth by a single metric and start seeing yourself as a whole person whose sexuality is one beautiful part among many. Let's turn toward physical fitness and pelvic health. The pelvic floor is like any other muscle group. It can be too tense, too weak, or well-balanced. Orgasm involves rhythmic contractions of the pelvic musculature. For some men, regular ejaculation can be part of maintaining pelvic awareness and flexibility. Combined with simple practices like diaphragmatic breathing and occasional pelvic floor relaxation. Masturbation can help release unnecessary tension that accumulates when stress sits in the body. If you suspect pelvic floor dysfunction, pain, chronic tension, urinary issues, seek a pelvic health specialist. They can guide you beyond general advice into tailored interventions. But for men with a healthy baseline, mindful self-stimulation can keep you attuned to an area of the body many people ignore until something goes wrong. There's also a motivational benefit that is often overlooked: agency. Masturbation is one of the few domains where you set the pace entirely. You can slow down, speed up, pause, and listen. That autonomy can be quietly empowering. In a world where so much feels out of your control, taking 5 intentional minutes to reconnect with your body can remind you that you are not just a brain dragging a body around. You are an integrated being. That feeling of agency can spill into other choices: doing your workout, cooking a nourishing meal, or declining a commitment that would have overloaded your week. It's not magical thinking. It's the pragmatic insight that self-respect in one area supports self-respect elsewhere. Let's address a cluster of myths quickly and clearly. Masturbation does not cause blindness. It does not stunt growth. It does not make you use up a finite number of erections. It does not inevitably lead to social isolation. What can cause harm is not the act itself, but the context. Secrecy that breeds shame, compulsive patterns that crowd out the rest of your life, pairing arousal exclusively with extreme media, or using masturbation to numb emotions you actually need to process. That's why we emphasize mindful intent. Ask yourself, what am I seeking right now? Soothing, release, connection with my body, or avoidance? If the answer is avoidance, pause. Try a walk, a short workout, journaling, or a conversation with someone you trust. Then decide again with care. If you're in a relationship, you may wonder how masturbation interacts with loyalty and intimacy. Here's the calm answer. For many couples, self-stimulation is simply part of their landscape. It doesn't replace a partner, it doesn't diminish desire, and it doesn't declare dissatisfaction. It's a private expression that can coexist with a loving bond. The key is transparency. Agree on boundaries that honor both of you. Some couples prefer not to discuss it at all. Others appreciate occasional check-ins. There is no universal rule. There is only what the two of you choose together. If this topic feels charged, consider talking in terms of values: respect, honesty, time quality, rather than arguments about frequency. Values anchor the conversation in what matters. For men recovering from breakups, grief, or illness, masturbation can function as a bridge back to feeling at home in your body. Trauma and loss often disconnect us from sensation. By choosing a slow, compassionate practice, perhaps with breath and music, you can reacquaint yourself with safety in your skin. This is not therapy, and it's not a shortcut through grief. But gentle self-touch integrated into broader healing can remind you that pleasure and tenderness are still available, even in difficult seasons. If you have a trauma history, please go gently and consider professional support. Your nervous system deserves patience. Let's also touch on productivity and focus, because many men worry that masturbation will make them lethargic or unmotivated. The truth is nuanced. If you use it as a procrastination tool, it will reinforce avoidance. If you use it late at night and then sleep poorly because of screen exposure, you'll feel foggy the next day. But if you approach it mindfully and at times that don't cannibalize your priorities, it can be neutral or even supportive, reducing anxiety, helping you reset between tasks, or aiding sleep when you truly need rest. You can experiment, choose a 2-week window, set clear boundaries, for example, no screens, intentional timing, and a simple wind-down routine afterward, and observe how your energy changes. Data from your own life is the most persuasive education. I want to address spirituality and values with respect. Many faith traditions guide sexual ethics thoughtfully. For some men, abstaining or limiting masturbation is a meaningful discipline. For others, Integrating it into their life is compatible with their conscience. My role as a physician is not to override your beliefs. It's to equip you with accurate information so that whatever you choose, you're not making that choice out of fear or misinformation. If your community has mentors or counselors you trust, bring this conversation to them with humility. Health isn't only physical, it's the integrity of your whole person across body, mind, relationships, and values. Now, a few practical suggestions to keep masturbation aligned with health. First, set an intention before you begin. Am I seeking relaxation, better sleep, or simply reconnection with my body? Naming this helps prevent autopilot. Second, breathe. Slow exhalations activate the parasympathetic system and soften tension, especially in the pelvic floor. Third, decouple the practice from endless scrolling. If you use media, choose something calmer and consider taking regular breaks to explore what your imagination can do without external prompts. Fourth, be gentle. Use adequate lubrication if needed and avoid aggressive friction that leads to irritation. Fifth, protect your privacy and time. Close the door, silence notifications, and give yourself a finite window so the practice doesn't expand into your whole evening. And finally, notice how you feel afterward. If you feel calmer, kinder, and more present, you're probably on a healthy track. If you feel depleted, ashamed, or more restless, it's time to adjust. Let's return to the central theme: benefits, plural. Because when you look at masturbation not as a guilty secret, but as one option in your self-care repertoire, several domains can brighten. Your sleep can improve because your body has had a chance to discharge tension. Your mood can stabilize as your nervous system experiences a predictable, soothing ritual. Your sexual function can improve as you learn to pace arousal, recognize your unique cues, and communicate better in partnered contexts. Your sense of agency can grow as you practice autonomy with gentleness. Your relationship can be supported, not threatened, when both partners communicate openly and honor shared boundaries. And your overall well-being can feel more integrated, not fragmented into good and bad urges, but harmonized into a mature, compassionate understanding of yourself. There is one more benefit that deserves its own spotlight: curiosity. Many men carry quiet questions about their bodies that they were too embarrassed to ask in adolescence. Curiosity is not immaturity, it's wisdom. When you approach masturbation with curiosity, what does my breathing do? How does my posture change sensation? What happens when I slow down just a little more? You are practicing a form of embodied mindfulness. That skill translates beautifully into relationships, exercise, stress management, and even creativity. Curiosity keeps you learning. It keeps you humble. It keeps you human. If you're listening and thinking, "I've had a complicated relationship with this," you're not alone. Many men oscillate between periods of avoidance and periods of compulsion. If that's you, I offer you gentle encouragement. You don't have to live at either extreme. You can build a steady, healthy middle. Begin with a simple experiment. For the next 2 weeks, keep a private log. No judgments, just observations. Note the time of day, whether you used screens, your emotional state before and after, and your sleep quality that night. Then look for patterns. Maybe you discover that late-night sessions paired with screens leave you wired and foggy, while earlier, mindful sessions help you unwind and sleep better. Use that insight to design a pattern that serves you. And if you can't find a pattern that feels healthy or you feel stuck, reach out for support. A therapist trained in sexual health can help you untangle habits, beliefs, and emotions with compassion. To close, let me speak directly to you as a whole person. You deserve a relationship with your body that feels like cooperation, not conflict. You deserve privacy without secrecy, pleasure without shame, and boundaries without fear. Masturbation, when practiced mindfully and in alignment with your values, can contribute to that vision. It can be a small, steady act of self-respect, one that doesn't need to be announced to anyone, yet quietly strengthens many parts of your life. If you found this helpful, consider a small experiment tonight. No screens, a few slow breaths, an honest intention, and an early bedtime. Pay attention to how your body feels tomorrow. Let your own experience be your education. And if something in this conversation raised questions or concerns, remember, that's what your healthcare team is for. Bring your questions. You deserve answers grounded in care, not judgment. Thank you for spending this time with me. I'm Dr. Catherine Harris, and I'll see you in the next video. Until then, be gentle with yourself, move your body, drink water, sleep well, and treat your sexuality with the dignity it deserves, because your body is not a problem to solve, it's a partner to listen to.